Welcome to Ulosca channel. Access all nursing practice questions. ATI Nursing 531 practice questions with answers.
Question 1. A nurse practitioner is prescribing lisinopril. What lab value should be monitored? A. Hemoglobin. B. Potassium. C. Platelet count. D. Calcium. Which one is the correct answer? The correct answer is B. Potassium. Explanation. Lisinopril, an ACE inhibitor, can cause retention of potassium by decreasing aldosterone levels. Monitoring potassium levels helps prevent hyperkalemia, which can lead to cardiac complications. Question 2. A patient on metformin reports muscle pain and fatigue. What is the priority assessment? A. Liver enzymes. B. Creatinine clearance. C. Serum potassium. D. Lactic acid level. Which one is the correct answer? The correct answer is D. Lactic acid level. Explanation. Metformin may cause lactic acidosis, particularly in patients with renal impairment. Muscle pain and fatigue are early signs. Checking lactic acid helps detect this rare but serious complication. Question 3. Which of the following is considered a primary prevention strategy in adult health? A. Colonoscopy at age 50. B. Statin therapy for hyperlipidemia. C. Influenza vaccination. D. Mammogram screening. Which one is the correct answer? The correct answer is C. Influenza vaccination. Explanation. Influenza vaccination is a form of primary prevention because it prevents the onset of disease. Colonoscopies and mammograms are secondary, while statin use is tertiary. Question 4. A nurse practitioner is reviewing a patient's EKG and notes a prolonged QT interval. Which medication may be responsible? A. Albuterol. B. Ondansetron. C. Amoxicillin. D. Lorazepam. Which one is the correct answer? The correct answer is B. Ondansetron. Explanation. Ondansetron is known to prolong the QT interval, potentially leading to life-threatening arrhythmias like torsades de pointes. Monitoring EKGs when using this drug is crucial in at-risk patients. Question 5. Which clinical finding is most concerning in a patient taking clozapine? A. Dry mouth. B. Drowsiness. C. White blood cell count of 2,500 superscript 3. D. Weight gain. Which one is the correct answer? The correct answer is C. White blood cell count of 2,500 superscript 3. Explanation. Clozapine carries a black box warning for agranulocytosis, a severe drop in white blood cells. A WBC of 2,500 superscript 3 is dangerously low and puts the patient at risk for life-threatening infections. Question 6. A patient with asthma is prescribed a corticosteroid inhaler. What teaching is essential? A. Take on an empty stomach. B. Limit fluid intake. C. Rinse mouth after use. D. Monitor for constipation. Which one is the correct answer? The correct answer is C. Rinse mouth after use. Explanation. Inhaled corticosteroids can cause oral thrush. Rinsing the mouth after use reduces the risk of fungal infection by removing residual medication from the oral cavity. Question 7. Which lab value indicates effective warfarin therapy? A. INR of 1.0. B. INR of 2.5. C. APTT of 60 seconds. D. Platelet count of 400,000 mem superscript 3. Which one is the correct answer? The correct answer is B. INR of 2.5. Explanation. INR is used to monitor warfarin effectiveness. A therapeutic range of 2.0 3.0 indicates adequate anticoagulation without excessive bleeding risk. An INR of 2.5 falls within this range. Question 8. What is the best indicator of kidney function? A. BUN. B. Serum creatinine. C. Urine pH. D. Glomerular filtration rate. Which one is the correct answer? The correct answer is D. Glomerular filtration rate. Explanation. GFR is the most accurate reflection of overall kidney function. It estimates how well the kidneys filter blood and can detect early kidney disease even when creatinine appears normal. Question 9. A patient on levothyroxine reports palpitations and anxiety. What should the nurse practitioner assess first? A. Potassium level. B. Heart sounds. C. TSH level. D. Troponin level. Which one is the correct answer? The correct answer is C. TSH level. Explanation. Symptoms like palpitations and anxiety can indicate excessive thyroid hormone levels. TSH helps determine if the patient is receiving too much levothyroxine. Question 10. What is the mechanism of action of beta blockers? A. Promote sodium retention. B. Stimulate beta-2 receptors. C. Block effects of epinephrine on the heart. D. Increase cardiac contractility. Which one is the correct answer? The correct answer is C. Block effects of epinephrine on the heart. Explanation. Beta blockers reduce heart rate and blood pressure by blocking beta-1 receptors in the heart. This limits the effects of epinephrine and norepinephrine, helping to control hypertension and arrhythmias.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.